name is Hans-Josef Feistritzer. I'm interventional cardiologist from Heart Center Leipzig, and it's a great pleasure for me to talk about the SOLVE-TAVI trial today. SOLVE-TAVI was an investigator-initiated randomized controlled trial conducted at 7 sites in Germany. It used a 2x2 factorial design, and the importance is that it was the first trial comparing the anesthesia strategy for TAVI, named conscious sedation versus general anesthesia. And this is of great importance because SOLVE-TAVI was the first trial using a hard clinical endpoint for this anesthesia comparison. It was a randomized multi-center trial using a 2x2 factorial design. More than 400 patients were randomized in the first arm to either the Evolut R valve or the Sapien 3 valve, and in the second arm to local anesthesia with conscious sedation on the one side, and on the other side general anesthesia. The primary results, the primary outcomes at 30 days have been published a few years ago, and the primary endpoint in the valve comparison arm was a combination of all-cause mortality, stroke, moderate or severe prosthetic valve regurgitation and permanent pacemaker implantation, and this endpoint was equivalent between both valve types. In the other arm, we used a combined endpoint of mortality, stroke, myocardial infarction, infections, and acute kidney injury, and also this endpoint was equivalent at 30 days between the conscious sedation group and the general anesthesia group. Today, we presented the 5-year outcome data from the SOLVE-TAVI trial. The combined endpoint was similar between the Evolut R valve and the Sapien 3 valve, but very interesting is that the stroke rate was higher, significantly higher in the Sapien 3 group compared to the Evolut R group. Regarding the anesthesia comparison, also the combined endpoint I mentioned before was not statistically significantly different between both groups. However, all-cause mortality after 5 years was higher in the general anesthesia group. These are the major results after 5 years. The take-home messages are that the Sapien 3 valve and the Evolut R valve can be safely used in the majority of TAVI patients. Of course, there are specific situations where one valve might be in favor of the other valve, for example, very calcified anatomies, small annuli, and so on. But for the majority of patients, both valves can be safely used. Regarding the anesthesia strategy, the SOLVE-TAVI trial showed that conscious sedation is the right way we should go in the TAVI business, and that conscious sedation is similar also in the long-term follow-up compared to general anesthesia. However, the higher all-cause mortality rate in the general anesthesia group we detected after 5 years is a cautionary sign for general anesthesia, which requires further investigation and further studies. The next steps are to, in my opinion, to make the TAVI procedure, the transfemoral TAVI procedure, less invasive, and by this way we currently perform the so-called double choice trial in Germany. It's also a randomized multi-center trial using, again, a 2x2 factorial design. On the one hand, we compare the accurate Neo 2 valve against the Evolut Pro Plus or FX valve, and in the second arm we compare conscious sedation versus local anesthesia only. And we hope that we can finish patient recruitment this year so that the primary 30-day results can be expected for next year. And I think this is the next step regarding the treatment strategy or anesthesia strategy in for transfemoral TAVI.